Hi, I am Nancy Hilton, the Chief Nursing Officer at St. Lucie Medical Center. I have been a registered nurse for 30 years and at this hospital for 13 years. Over the last year, throughout the hospital and within the Department of Nursing, we have embarked on our magnet journey. As part of this journey, we have adopted a nursing theory called nursing as caring. I want to take the opportunity now to share our stories. These stories convey our calls for nursing.
Welcome to St. Lucie Medical Center. As part of our Nurses Week 2008 celebration, we would like to share our stories of caring with you. At St. Lucie Medical Center, we have adopted the nursing as caring theory developed by nursing scholars Dr. Ann Boykin and Dr. Savina Schoenifer. The theory is based in human caring. The most basic premise of the theory is that all humans are caring persons and that to be human is to be cared and to live one's caring nature. The nurse as caring theory focuses on nursing as a discipline of knowledge and a professional service, as nurturing persons, living caring and growing in caring.
The 8 ingredients of caring are knowing, alternating rhythms, patience, honesty, trust, humility, hope, courage. Knowing. Caring for another requires the knowing of many things. Personal knowing, or knowing of oneself, is integral in coming to know other. Knowing of other refers to the understanding of another's needs and responding to those needs. Both knowing self and coming to know other is a lifelong process.
An important concept in the theory, nursing as caring, is a nursing situation. The nursing situation is an expression of the shared lived experience between nurse and nursed. Today we will be sharing our stories that demonstrate the ways in which we live caring here at St. Lucie Medical Center.
I am Maria Coulson. I work in intensive care unit. I've been a nurse for 35 years now. I have many sharing moments, and one most memorable moment is the one that had happened 5 years ago. This is a man in his 20s. He suffered a spleen injury from being hit by a baseball, playing baseball. He came to ICU very unstable. We're monitoring his H&H and his vital signs, and I was assigned to take care of this gentleman. About 2 o'clock, all of a sudden his blood pressure dropped down significantly. He got very pale, very anxious. And I knew right then and then I need to do something. I have called the doctor and he ordered emergency surgery. His post-op care was uneventful, no complications. But you know, thinking about it in hindsight, I have saved this guy's life. I watch him frequently, like at least every 15 minutes. He was transferred later on to the floor and went home. Didn't hear anything about it later on. And about 2 years ago, he stopped by the unit. I didn't really recognize him, but he did recognize me. He said, "Are you my nurse, Maria?" And I said, "Yeah." And he was carrying a bunch of flowers. And he said, "Don't you remember me?" And I said, "No." He said, "You have saved my life. You watched me like a hawk. Without you being there, I probably not be here standing in front of you." And I thought about it. You know, we do a lot of extraordinary things, but we just take for granted. But this one really is memorable. This cemented my feeling and my passion of being a nurse. Thank you very much. I am St. Lucie Medical Center. I am living, caring.
Alternating rhythm. Caring requires one to be able to move between a wider and more narrow framework. An example, being able to apply knowledge of a disease process to the caring of other that is specific for that individual.
Hi, I'm Mike Rumble. I'm the Director of the Spiritual Services. And to me, a caring moment means being a compassionate presence. It means taking everything that's within your heart and your soul and your spirit, being a companion of suffering and walking and journeying with another person that's hurting, a family member, a patient, coworker, and being able to engage yourself and walk with them in their heart, in their spirit, and in their soul. And to such an extent that you mix that and match that with your clinical skills, your medical expertise. And in that magic moment right there, there's a healing that transpires, a relaxation response that takes place. And a person is set free and able to be calm and relaxed. There's a wholeness and a completeness and a healing and a transformation of wholeness. And it is a miracle that takes place at that point between the nurse, the minister, the patient caregiver, and the patient themselves and their family. Thus there is wholeness, thus there is completeness, and there is balance. And I thank you very much for the honor and the privilege. I am Mike Rumble. I am St. Lucie Medical Center, living and caring.
Hi, I'm John Buchanan. I've worked at St. Lucie Medical Center for 13 years. I'm a respiratory therapist, and most of my time is spent in the critical care unit. And I'd like to share with you one of my caring moments. In March of 2008, I received a phone call in the intensive care unit from a doctor's office. And the doctor asked me if I was going to be there for a while and would I please wait. He was sending one of his patients over that wanted to meet me. And I said okay, and I was waiting in the ICU, and I seen a little frail lady walk in, and right away, as soon as our eyes met, she started crying, and I walked over to her, and I just held her for a while. And until she stopped crying, and emotionally she was a little bit better, and she explained to me that she really didn't know who I was. She just remembered that I was an inhalation therapist with a beard. And during her procedure here, it was found that she was just loaded with cancer from head to toe, and they didn't expect her to live. They opened her up and looked at her and then closed her right back up and explained to the family that her time on this earth was very short. Well, now it's 2 years later. She was in the hospital in 2006. And she came in and she said to me she remembers me talking about prayer and Reiki with her. And that's, to me, prayer and Reiki is energy that comes from God, and He uses us as channels. He gives us gifts. My 5 gifts are love, compassion, mercy, grace, humility. And I believe out of all of these, the most important to me is compassion. Because compassion is where I can just let the walls down from around my heart, pick my heart out and open it up and share that special moment with somebody. And to give them my heart so I can feel their pain, I can feel their suffering. One of the most beautiful experiences of this meeting was when the lady told me when I laid my hand on her head and on her chest, she felt this beautiful energy go through her body. It took away all her fear, all her depression, and it never came back. And we just hugged. I walked her to her car, and she says, "John, the cancer is very aggressive. I don't expect to be on this earth much longer. But I will never forget you. I will never forget that energy. I will never be afraid again." And that to me is the essence of who I am. I am St. Lucie Medical Center. I am living and caring.
Hello, my name is Dr. Joe Cariello. I've been a licensed physician in Florida for about 15 years, primarily in the emergency room. I've worked many different ERs in Florida, ranging from Sebring all the way through Palm Beach County, and primarily here in St. Lucie for the past 12 years. I must say I've been very happy over here. It's one of the few places where we have a sense of family. The nurses, the physicians seem to honestly care about the care of patients, about each other. We'll cover each other if there's a problem. If I know from personal experience, had a rough go of it a few years back, and all of my people I work with stepped up to the plate and helped me out. But essentially, I'm very happy over here. I've been working here for 12 years, and I wouldn't dream of working anywhere else. I am St. Lucie Medical Center. I am living and caring.
Hi, I'm Janie Ladico. I'm a registered nurse at St. Lucie Medical Center in the post-anesthesia care unit, part of the surgical services department. I'd like to share with you a story about the caring people in our department. One day we had emergency surgery on a young man who was brought in with an unstable cervical spine fracture. He was brought to the operating room. Minutes later, his distraught mother showed up, knowing she had just missed seeing him before his surgery. He had not yet received anesthesia, so the surgical team had a few options. One, they could have brought him back to the pre-op area, but that could have further endangered him, as any movement could have made his condition worse. Another option was to send the mother to the waiting room and she could see him after surgery. But since he hadn't had anesthesia yet, the team had a third option, and this is the one they chose. They dressed the mother into the surgical scrubs and escorted her into the operating room, reuniting her with her son so she could see him before he had surgery. He had a good outcome with the surgery. I know it meant a lot to the mother as well as the patient, and I'm proud to be working with such compassionate people. I am St. Lucie Medical Center. I am living, caring.
Patience. Patience is allowing another the opportunity to grow in their own time. It is not passive, but requires participation with the other by giving fully of oneself. It allows for an individual to grow in their own way.
Hi, I am Maria Seidel. I'm a registered nurse and I am a nursing instructor. I have been bringing students here for about 14 years now, and the reason I continue to come to St. Lucie Medical Center is because I see caring behavior modeled every single day by the nurses here. The students are exposed to wonderful traditions, caring, compassion, and genuine concern for patients. And that's something that me as an instructor, I feel that is taught by other people is very important. I am St. Lucie Medical Center. I am living caring.
My name's Megan. I work in the emergency department. I've been a registered nurse for 5 years. My caring moment is twofold. The first part involves myself and a patient. This woman was about 70 years old, came in by rescue, had extreme difficulty breathing. Her oxygen level was only about 70% and she required rapid sequence intubation. We intubated her, but we were unable to keep her sedated due to her being unstable and her blood pressure was too low. So she was awake and aware of all that was going on around her and she was terrified. I stayed at this patient's bedside and provided support to her while maintaining all of the things that needed to be done for her, medications and monitoring. Her husband had come in and explained to me that the last time she was intubated, she ended up in the ICU for several months, had to have a trach, and ended up in a nursing home for several months more before she was eventually could breathe on her own. She was terrified of that ever happening again, but had never written anything down. I explained to her that in order for us to maintain her life at that point, that she needed to be intubated. She noted to me by nodding her head that she understood. I spent a lot of time at the bedside explaining to her, you know, and keeping her comfortable and holding her hand. I ended up taking her to the ICU, and while I was at the ICU and I was about to leave, she grabbed my hand and she pulled me down to her, and she cupped my face with her hand, and she had tears in her eyes, and she just mouthed the words to me, "Thank you." And it really made a difference to me as a nurse knowing that I made a difference to her. My second part of my caring moment was the fact that my coworkers stepped up and cared for all of my other patients to enable me to be at the bedside with that patient. I am St. Lucie Medical Center. I am living caring.
I am Millie Drysdale. I work in the progressive care unit. I have been a nurse for 18 years. Caring to me is motivating someone to get well and to participate in their care. I'm reminded of a patient that was depressed, did not want to get out of bed, did not want to eat. Physical therapy went in one day to walk him and came out and said he didn't want to get out of bed. So I went in, sat by his bedside, and I had a little talk with him. I said, "Do you have grandchildren?" He said, "Yes, 5. He didn't remember all their names, but I saw a spark in his eyes. I said, "You have to fight to get better." I said to him, "I don't know about you, but whatever I want in life, I have to fight for." Later on that day, I was sitting at the desk charting, doing my notes, and there was a shadow standing over me. It was this same patient. I looked up in amazement. I said to him, "Who brought you out here?" He looked down at me and he smiled and said, "I did it myself." This made my day. Caring to me is having someone getting well and knowing that you were a part of that caring moment. I see this every day in my journey. It is amazing what a little encouragement can do to someone when they really need it. I am St. Lucie Medical Center. I am living, caring.
Honesty. To care, we must be able to see the other for who they are and what they want. This includes being honest with self and being able to learn from mistakes in order to grow in caring.
Hi, my name is Will Pruitt. I'm a registered nurse here at St. Lucie Medical Center. I work on the medical surgical floor. I'm a graduate from Florida Atlantic University. Before I started working here as an RN, I worked as a nurse tech, and I was also a student here for about 3 years. I felt like the staff here at St. Lucie Medical Center did a good job caring for the patients as well as caring for their new hires and their new nurses coming to work here. The overall attitude towards the new hires was very accepting. They were always willing to answer questions, and that made me feel really good about coming to start my career here. My name is Will Pruitt. I am St. Lucie Medical Center. I am living caring.
Hi, I'm Dr. Fernando Petri, Medical Director for the Hospitalist Program here at St. Lucie Medical Center. Since I've been here, I've had a wealth of experience with working with our nursing staff as well as all the other staff members here. And it has been my experience that the nursing staff here has been very caring and compassionate to our patients. They exhibited a level of professionalism and compassion that is unparalleled. Every day working with them is a privilege and has been an experience since I've been here for 3 years. It has shown nothing but the highest level of professionalism, and they have exhibited nothing but the highest level of compassion for all our patients as well as dedication to their work. They are very happy to work here and very happy to help out the patients in caring for them during their stay. I have hoped to work more years here so that I can continue to experience that caring and compassion that the nurses have, and I hope to be here for several more years. The hospitalist program will increase, hopefully, the quality of care that patients receive, and will just add to the amount of care that patients are getting here from the doctors as well as from the nurses. Thank you.
Hi, my name is Carrie Tremblay, and I'm a family nurse practitioner. Graduated just 2 months ago. I've worked here in obstetrics for 10 years, and I'm really proud to be a nurse. I think it's the best career in the whole entire world. Living caring to me is a very sensitive subject, because I really believe in living caring and the lived experience between the nurse and patient. And now that I'm about ready to enter another level, I'm sort of looking at nursing from another perspective, and that's evidenced by living caring from nurse to nurse standpoint, where a lot of times in nursing, I was grown in nursing in a culture where we sort of eat our own. And it's kind of been the history about how we do that. We've kind of not really been warm and fuzzy to each other, whereas that is changing. And that is changing through living caring and through embracing moments that you share with other nurses in other situations where the experience where you see maybe a new nurse that is having a difficult time with a patient, instead of hindering that nurse-patient relationship by saying, let me do it because you don't know how to do it, which is sort of, unfortunately, the way it used to be. Instead of that, it's noticing that nurse needs some time. She has the skill, she has a license, she just needs an extra hand in that moment to get that patient the care that they need. So by looking at nurse to nurse and walking in a room and seeing a patient that clearly is a little above the new nurse's skill, that what we do here at this hospital best is we are able to look at that situation and say, you know what, that nurse needs a little help. I'm just going to go in and I'm going to help her by showing her or by talking to the patient, and she is going to embrace that moment with her patient that she's already bonded with, and she's going to embrace the moment with the nurse that's living caring in that moment to make that experience great and growing for everyone. My name is Carrie Tremblay, ARNP. I am St. Lucie Medical Center. I am living caring.
Trust. Caring is trusting that the other will grow in their own time and in their own way. Trust cannot occur if we try to force others to conform to our desires.
Hi, my name is Elisa Dalman-Hess. I'm one of the educators here at St. Lucie Medical Center, and I've been here since 2000. But I've been a nurse for 45 years, so I'm the champion longevity person, which means to some people I'm old. But my fondest recollection here at St. Lucie Medical Center, and I have been a patient, but my husband has been a patient on every unit except women's services. So he has experience firsthand, and I have experience firsthand as a family member, which concerns many of our patients' families. What impressed me was that he was a direct admit from the physician's office where they discovered that he had a blockage of the carotid artery and needed surgery immediately. So we were both a little apprehensive when we were escorted to the 4th floor and to his room. And there on the patient's pillow, on his pillow, was a note welcoming him, written by the nurse who was going to take care of him, with a note saying that, in essence, she was busy with another patient right now, but the PCT, the nursing assistant, would be in to take his vital signs. On the bedside table was a gown, and she asked him to change into the gown. But besides the gown, there were toiletries on the windowsill, a razor, everything he could possibly need, including a basin. And it was just a comforting thought that someone cared enough to write a note. The nurse was in. I don't think we waited more than 5 or 10 minutes before she came in, introduced herself, and was such a kind, reassuring person. She had no idea that her patient was related to an employee, so it was not a matter of preferential treatment. This is the way she treated all her patients, and she told me she did this all the time. And I thought, what a caring person that she is, and what a wonderful thing to do to reassure the patient and the family member. Anyway, I am proud to say that I am St. Lucie Medical Center, and I am living caring, experienced by me in many ways, towards patients, towards staff, towards family. Thank you.
My name is Chris Campbell. I'm an RN and a member of the Surgical Services Department, working in the recovery room. I've been with HCA for 20 years and with St. Lucie Medical Center for 10. What impresses me about our hospital is the random acts of kindness that the hospital staff extends to each other and members of our community every day. I frequent many departments in the hospital on a regular basis. Gestures of kindness, maybe insignificant to some, mean the world to others. Gestures of concern, compassion, and caring. I've seen staff hugging family members or loved ones in the ICU and surgical waiting rooms, giving a stranger their change so that they can have a soda or a snack, assisting a staff person or family member to their destination by offering a hand or walking with them, holding an elevator door open for a stretcher or wheelchair patient, offering kind conversation or encouraging word that may ease the tension of a patient, family member or loved one, giving a smile in the midst of chaos. I'm proud of St. Lucie Medical Center. I think our staff makes a difference in the lives of everyone who enters our doors, and it happens every day. I am St. Lucie Medical Center. I am living, I am caring.
Hi, I'm Sherry Phillips.
And I'm Lynn Pisner. We are registered nurses at St. Lucie Medical Center, and we work on the medical oncology floor.
I've been a registered nurse for 16 years.
I've been a registered nurse for 24 years.
I am
St. Lucie Medical Center. I am living, I am caring.
Humility. Caring is being willing to learn more about self and other. Humility is learning from our own mistakes. Humility is acknowledging that there are many ways to care, and that one way is not superior to another.
I'm Carol Saxton. I work in ICU. I've been here 11 years employed by this hospital. 10 of those I've worked as a nurse. And my story of caring involves a patient that I took care of on our orthopedics unit who wrote a letter to the editor of our local newspaper about the kind nurse and caring treatment he got here. And I was really proud that he wrote a nice letter about me to the paper. and I thought he cared enough to do that for us. So that was a good day for me. I am St. Lucie Medical Center. I am living, caring.
Hi, my name is Rachel Rouse. I am an RN on Ortho Neuro 2nd floor. I am here today to share a story of an event that happened on our unit. It was about a young woman who came from out of town, accompanied by her husband and mother of 3. She was admitted for uncontrolled seizures. During the first 12 hours of her admission, she started to develop seizures about every 15 to 30 minutes. Our nursing staff was very attentive to her needs, and her husband was at her bedside at all times, at times with tears in his eyes. The primary nurse was able to care for the patient, as well as look at the whole picture and care for getting her the medications, communicating with the physician and the other nursing staff to help provide the best care for this woman. Other than the seizures, the woman also was experiencing severe headaches. At this time, once the seizures were controlled, the headaches were still there. One of our nursing techs was able to take the patient and take a warm basin of water and help wash her hair and comb it out and relieve her of that headache. The primary nurse was able to care for this patient and the husband and the whole family during this tough time in need. Our whole unit was able to pull together to care for the seizures, the headache, and the whole family. I am St. Lucie Medical Center. I am living caring.
My name is Melody Zimmerman. I've worked at St. Lucie Medical Center for almost 18 years in the radiology department. And in that time, I've met so many caring people. One day that really stands out in my mind is the day my mother was brought in from a local assisted living facility to the emergency room. I went over to find out where she was, and when she came in, I noticed how busy they were, and I knew it would probably take a while and that she would be in there for a long time and be very nervous. We were seen really quickly by a nurse that was very caring. She came over with a big smile on her face, talked to my mom, put her completely at ease, asked the necessary questions, and went to find a doctor to have her testing done. In between that time, I could see how busy she was. She had many other patients to care for, and she took the time to come back, see my mom, see if she was all right, and give her that nice smile. After the testing was done and the doctor had decided that my mother was okay and could be discharged, we had a little more time to wait before he could get his paperwork done and before she could leave. She mentioned a comment that the nurse happened to overhear, that she'd missed her afternoon tea, which is very, very much of a treasure to her. And she said, I would feel so much better if only I could have my cup of tea. I couldn't believe within moments this nurse turned around and came back and preferred this cup of tea to my mom. And you have never seen an elderly lady with such a smile on her face. When we finally got the go-ahead that she could be discharged, she made sure she found that nurse and grasped her hand and told her how much it meant to her that she took the time out of her busy day to take care of an old woman and make her so happy. And to this day, whenever we talk about the hospital, she tells so many people that she can't believe at St. Lucie Medical Center she was made to feel special by a nurse that really took the time to care. I am St. Lucie Medical Center. I am living, caring.
Hope recognizes that the moment is alive with possibilities. Through caring, there is hope that the other will grow.
I'm Dr. Dawkins. I'm one of the physicians here at St. Lucie Medical Center, and I've been here for 8 years, and I've been happy to be affiliated with the facility as well as the nursing staff here. They do a good job and always seem to be pleasant, which I guess is a reflection on how they're feeling here. Feel like a family, and just want to say congrats to all the nurses. Keep up the good work. I am St. Lucie Medical Center, and I am living, caring. Thank you.
I'm John Downing. I was a patient here at Port St. Lucie Hospital. I just was released yesterday. I had to come back to show my appreciation and respect for the nursing staff up on the 4th floor. They're called co-ops. I had never received medical care as I had in the past. I've had 14 operations in various parts of my body in numerous hospitals. None of them could shine the shoes of these nurses. I was so surprised of the dedication, the sincerity, and how concerned they were about my health. They didn't make me feel when I called them for something that I was bothering them. They come in, they smile, and they always made me feel comfortable. I also was very serious about the fact I worked for 3 major corporations where the morale of the workers were a very important thing. If the morale is up, the work is up. I had to find out why that nursing staff performed at a higher level than all the other nursing staffs I've had. Because the nursing staff are the only ones that deal directly with the patient. And if they give good service to the patient, that patient's going to leave and recommend this hospital to other people. A word of mouth is the big thing, not the publication that comes in the paper that rates you all a hospital. That's all political. I go to a hospital, I want someone I know to recommend a good hospital to me. And this is the place to come.
Hi, I'm Ashley Register. I work at St. Lucie Medical Center on the Progressive Care Unit as a registered nurse. I've been a registered nurse for a little over 2 years, and I've worked here the same amount of time. Back when I was a student nurse in training, I also worked on the Progressive Care Unit. It was then that I met a patient that was newly diagnosed with congestive heart failure. I tried to set his mind at ease by teaching him about his new diagnosis and visiting with him and his wife. Unfortunately, the patient has to come back to the hospital a few times each year, and each time he's here, I stop by to talk with him and his wife and set his mind at ease. Just these few minutes of my time helps his stay go so much more smoothly, and it puts a smile on his face. That's what I love about being a nurse. I am St. Lucie Medical Center. I am living, caring.
My name is Ana Lisa Montejo. I am a registered nurse for 15 years. I'm working at the Medical Surgical Department. I am St. Lucie Medical Center. I am living, I am caring.
Courage. Courage in caring is expressed by going into the unknown, the ability to approach the same problem in a new way. Our past experiences will guide our intuition.
I'm Dr. Adam Curtin, one of the surgeons here at St. Lucie Medical Center. In my experience, I've had the opportunity to work with many nurses, and I must say that here at St. Lucie, I've been able to work with some of the most experienced, caring nurses I've seen. Last week, I had a patient who had an operation. She had a tough time, but when she got home, I found out that one of our nurses called the patient just to see how she was doing. It's that kind of thing that makes me feel good when I hear these stories from my patients. I'm very happy working here, and I entrust the care of my patients to the nursing staff at St. Lucie.
My name is Mary Unger. I'm a nurse case manager in the emergency room. I've been a registered nurse for 34 years. I want to tell you a story about a patient that came into our emergency room. She was vacationing here with her 12-year-old daughter. The emergency room nurse came to see me because she was concerned that the child may not have a place to go because there were no other family or friends that were with them here on the vacation. In situations like this, we usually have to call the Department of Children and Families, Hibiscus House, some type of resource to be able to place the child so they're in a safe situation, because obviously she couldn't go back to the hotel alone. I went in to talk to the mother and to the girl, and when I went in there, it was obvious that the mother did not want the child to leave. She kept repeating herself over and over and over again, and obviously this was part of her acute stroke. The daughter was sitting there very quietly at the bedside. She didn't take the drink of water that was offered to her. She didn't want to get up and go to the bathroom. She didn't want to leave her mother for anything, declined any food that was offered. Her whole being was just totally comfortable with just being there for her mother, and that was the most important role she could play. I did offer to take the child home with me because I had to come back the next morning for an early meeting, but I knew that this was not going to be an option that either one of them would have accepted. I then called the nursing supervisor and I explained the situation to her because it was obvious the woman was going to be admitted to the hospital. And she totally supported my decision that the child needed to be able to stay with the mother. What I hadn't shared with you up until this point is that this child was adopted. And just prior to the woman having her stroke, she was on the phone with New York trying to arrange for the sibling, the biological sibling of this daughter, to become adopted by her also. Anyway, the nursing supervisor was very supportive of the plan, and in order to convince the nursing unit where she was going, since this was totally against policy, she went ahead and called the division director. And the division director also supported this decision to let the child spend the night. So she was placed in a private room. She had a cot made for her for the night, and the two of them were able to be together. In the meantime, the emergency room nurse had been able to contact the patient's nanny and also left a message for the patient's sister on her cell phone to let them know that the patient was hospitalized and that there was a concern for the daughter and how to reach us, etc. The next morning I went and checked on them, and when I went in the room, the patient's sister was there. And I was really surprised because she had been on her way to the Far East with some work project, and the sister said, "I got the message and I came to Florida with the first plane I could get." And at that point they were getting ready to go down to the emergency room and pick up a taxi to go back to the hotel. And the sister said to me that she was so grateful that she had been able to have her sister and her niece come to such a wonderful, caring place. And I had to say, that I agreed with her, because we do have lots of policies here, as any hospital would, but we're not such a place that we can't change things around to accommodate the patient needs in the right way to meet the patient demands. And I think in this situation it was the best outcome for the patient and the family. I am St. Lucie Medical Center, and I am living, caring.
We hope you enjoyed our stories. Our purpose in sharing was to bring to light the caring moments that are experienced throughout our facility every day. We invite you to share your special moments so that others too may grow in caring. Each and every story will be shared in our nursing scrapbook.
It is very exciting to hear all of these caring moment stories. I know as nurses, we truly make a difference to patients and families. I am Nancy Hilton. We are St. Lucie Medical Center. We are living, caring.